Ladies and gentlemen, circumstances dictate, unfortunately, that we address today such a serious topic as the COVID-19 pandemic through recorded messages. It is a kind of ironic that our interaction in the framework of the 21st Special Conference of the United Nations General Assembly has been limited to a rather impersonal exchange. This exactly because of the need to protect ourselves and, of course, others from the pandemic. However, even our virtual presence sends a clear message to the international community as well to our home countries. A message of unity and a message of truth. The cross-border transmission of viruses and their dispersion within national borders have brought to the fore a situation which has been always around. The fact that, most unfortunately, we were slow to hear the wake-up call of previous pandemics, especially during the last 2 decades. The repercussions that COVID-19 has had on health and on economic, social, and even daily simple issues of our lives are more than evident everywhere. At the same time, we need to underline that ongoing armed conflicts only make efforts to contain the virus more difficult and less effective. In this vein, we join once more our voice to that of the United Nations Secretary General for a global ceasefire. Regretfully, last century's model was built on the premise of national action, with only a marginal degree of international cooperation. It is clear that this model does not correspond to the current unprecedented conditions in our interconnected and interdependent world. There is an undeniable need for states to grasp the new reality and get down to work together. Work also with relevant entities and especially with the World Health Organization. We should concentrate our effort into assessing the facts and, where necessary, to usher reform on the World Health Organization. It is equally important that we do not miss the big picture. This is best described by the logic of the One Health approach. The notion describes the need for a common understanding of the fact that human health, animal health, and plant health form the unbreakable chain of parameters of the same equation. If we wish to solve this equation, we need to take all of them into account. The World Health Organization, together with the Food and Agriculture Organization and the World Organization for Animal Health, are important pieces of this equation in our way forward. We need to support and strengthen them within the more general framework of the United Nations system. Safeguarding equitable access to a vaccine as a global public good and unimpeded treatment of COVID-19 should constitute key elements in the foundation of tomorrow's health architecture. Assuring necessary funds, which will allow economies to restart and societies to remain stable, is a crucial point in the equation. The pandemic will have helped our international system make a significant leap forward, if by its end we have all realized and agreed that multilateral effective action is the only answer to the collective challenges of the 21st century. I wish to conclude by paying tribute to doctors and healthcare workers all over the world for their selfless offer to their fellow man and to humanity. Thank you.